would be, you've been in the field long enough now, what would be some of the challenges that you working in the field that you face every day?
Google.
Dr. Google?
Dr. Google. Oh my gosh. You know, gosh, you can find a lot of information online, don't get me wrong. It's an amazing resource, it's a valuable resource for a lot of information. However, nothing can replace the doctor and the doctor's office for exactly.
I think another good one that just kind of comes to the top of my mind, and it's not so much about, it's not specific for animals, but the CDC has some
yes.
really good information, if you haven't gone there, that talks
Definitely.
about parasites, diseases that both our pets can get and that they can give to us as well. So I think that's another really reputable
That's huge.
resource.
Yeah, because there are so many, and you don't even think about it, but it's very easy for some parasites and things like that to be transferred from your pet to you. So it's important to, and CDC has a lot of great information on that.
Yeah, absolutely.
Yep.
So going back to building the relationship with the clients, when you form that bond with a client, tell me what that's like for you.
Oh my gosh, it's great. It kind of transcends the whole client professional experience. It's more of a friendship at that point. And when you get to a point where you feel like that with a client, 9 out of 10 times that's when the client says, please don't call me Mrs. Thomas, call me, Jane. My name is Jane. That's a really great feeling because they trust you.
That's
and that's
so
huge.
important that you said that.
Yeah, that's huge. So if you can earn that trust and keep that trust from a client, I mean, there is no better feeling because you've been educating, you've been speaking to them, you've been connecting with them, you're connecting with their pet. When their pet comes up to you and gives you kisses all over your face because they're happy to see you, I mean, there's no better feeling. You're doing your job, and I feel like you're doing your job, but you're taking it past the job. You're going kind of above and beyond in that respect.
Absolutely.
And it feels good when it's a good connection there.
Yeah.
Yeah, it feels great.
And one little side note, one thing I always enjoyed when I was in the hospital is those clients that you form bonds with during Christmas time.
Oh.
All the cookies and baked goods, and sometimes it wouldn't even have to be a holiday, just everything that they bring you. It's
You
it's
can't be
really
on a
nice
diet
to
in a
feel
veterinary
appreciated.
clinic around the holidays.
No, not at all. Not
There's
at all.
a table in Christine's old office, big round table, and literally covered with treats of all sorts. Yeah, it's crazy. But that's just,
To have that love.
they think of you.
Yeah, that's it.
awesome.
That they
Yeah.
took so much time to either make something for you or
Yeah.
go out and buy something to bring joy to your life. That means so much.
We have one client who knits us scarves, blankets. She is an incredible knitter and crocheter, and every single Christmas she comes in with a giant box of scarves, blankets, throws, all of this stuff, and she's one for everybody that works in the hospital. I mean, that's incredible.
That
Somebody's putting their
absolutely
heart and
is.
soul into something, and they are bringing it to give to you as a gift. It's amazing.
Yeah.
Yeah.
Absolutely.
Truly.
Okay. So when you're talking to pet owners, I know you've obviously expressed, your concern and passion about education. Just any general message or any general conversation that you're having with a pet owner, what would be like one or two of the most important things you want them to know?
The importance of prevention as opposed to treating the illness that you're trying to prevent. So heartworm prevention, for instance. It is, if you have, okay, I don't know the prices offhand, but if you have got a 45 to 88 pound dog, a year's worth of heartworm prevention is about $80 to $90. And that's one preventative every 30 days. It's a chewable. Usually the pet thinks you're giving it a treat. They love it. Most pets love it. A few don't, but the cost of heartworm treatment, depending on the size and the weight of the dog and how bad the heartworm infestation is anywhere from about $700 to $1,500.
huge difference.
Huge, and it's not pleasant for the pet. Heartworms is exactly what it says. There's worms in the pet's heart. I mean, you're talking about worms infesting the pet's heart so they can't breathe well. They really have a hard time breathing. It's very uncomfortable. The treatment, although has come a long way and is not as bad as it used to be, it's still not the most pleasant thing for them. And if you just do the preventatives every 30 days, you don't have any of that. And again, heartworms are contracted through an infected mosquito. So when you have those clients who say, well, my pet doesn't go outside, you know, it's like a little Yorkie or something, it uses the pee-pee pad in the kitchen and it doesn't go outside much, or it's a cat that stays inside, mosquitoes come in the house.
Absolutely.
You know, and that's all it takes is one bite from an infected mosquito to make a dog's life miserable. And for cats, there is no heartworm treatment. So if they get heartworms, unfortunately, it is pretty much a death sentence because I mean, they may, you know, you don't know how long they're going to have. There's no treatment.
Could live a long time.
They could live a long time, but there is no treatment. You cannot treat that.
Right.
And then the parasites, I would say the importance of doing fecal examinations, making sure that the feces is clear of parasites. So many of them are transmittable to humans. And so, you know, making sure that your pet doesn't have those is huge. I mean, it's just such a minor thing, you know.
Yeah.
That's all. It's just a question of getting a little bit of the feces on a microscope, making sure there's no parasites. You do it, we recommend doing it twice yearly at our clinic. Especially if your pets are, you take them on walks, you take them in spaces where other dogs are, you don't know what other dogs have, you know?
Yeah.
And so the importance of making sure that that's clear and the importance of the vaccinations. You know, just making sure that they're protected against the parvo distemper, you know, all of those viruses. Rabies, of course, is the law here in Georgia. We have to vaccinate for rabies. Animal cough, it's a minor thing, but if left untreated, it can become something very major. And again, expensive. So,
what's interesting is that with everything going on with the Zika virus, is that maybe now, in terms of our pets, at least maybe people will be a little bit more enlightened or alert to the fact that mosquitoes are such a serious issue, and you know, maybe it will start some more conversations about, you know, do we need to be concerned about mosquitoes and our pets? And then for those people who think that heartworm disease is caused by like an intestinal parasite, that's when people on the vet care team can say, you know, well, we don't know about Zika virus in animals yet, but with mosquitoes in general, this is what happens. They transmit heartworm disease.
They're carriers of some nasty stuff.
Absolutely. I don't really know why they exist.
I don't either. I don't like them.
The other thing too about the intestinal parasites, I know that you've touched on quite a bit, you know, that there are things that we can get from them too. I think what's really important for people to understand, if they don't know it already, is that if you have particularly young people or elderly people or anybody who is immunosuppressed or immunocompromised in your household, those people are really going to be at risk for developing diseases from those intestinal parasites. So certainly something to think about.
Yeah, and especially the little kids, you know, you've got a yard, for instance, where, you know, Fluffy and Rover are doing their business, and your kids are out there running around barefoot, you know. I mean, roundworm, hookworm, whatever, I mean, these things, they can pick these things up. I mean, just from stepping in the yard.
Absolutely.
Where your pet has gone to the bathroom.
Or playing in sandboxes too. That's another huge one. I definitely don't advise that families have sandboxes, or at least if you do, keep them covered when they're not in use. So yeah, very good points.
Yeah.
So anything else that you'd like to add, or anything else that you would like to talk about today?
No, I can't think of anything else.
Okay. Well, Dana, I really appreciate you coming out today. I've enjoyed the conversation, and hopefully everybody out there can learn a little bit from this, both the pet owner and people on the healthcare team as well. And let's start having more of these conversations and see how we can improve the service, the expectations, and of course everything that we do for our pets. So